So I'm a board certified child, adolescent, and adult psychiatrist who also is a social media content creator on TikTok. And a question I get commonly in our PMHNP coaching community is patients coming in with these TikTok diagnoses: ADHD, DPDR, Tourette's, Ehlers-Danlos, and they are saying that they have these diagnoses and they want treatment for them. What do you do? So here I'm going to break down exactly what TikTok diagnoses are and how you can address it if it comes into your office. So what's actually been happening is that when COVID happened, TikTok exploded. And there's a lot of diagnoses that people have been showcasing on TikTok that they have. Now, whether they have them or not is a separate question because some people fake diagnoses for clout and whatever, and that's a different topic. But the point is that these diagnoses are gaining more attraction on the social media landscape. So I'm referring to diagnosis as ADHD, which is autism and ADHD. So diagnosis like that. So DPDR, which is depersonalization, DPDR, depersonalization derealization disorder. I'm referring to Tourette's. So Tourette's I'm referring to. I'm referring to EDS, Ehlers-Danlos syndrome. So all of these are all, multiple personality disorder, or DID, dissociative identity disorder. So basically, these are all what we call TikTok diagnoses that have been exploding in popularity lately because of TikTok. So now, let's say a patient comes to your office and they say, "Hey, I have Tourette's," and like they're doing this, or "Hey, I think I have autism." Another common thing, especially as a child adolescent psychiatrist, I get this a lot. So what do we do about this? So the first, I have a framework that I like to walk people through. So the first thing that we have to do is validate. So this is the cornerstone of therapeutic relationship. You have to validate the patient for what they are experiencing. So you say, "Wow, that sounds stressful. That must be, you must be dealing with a lot. It must be hard kind of trying to understand if you have this or not." Point being that, you validate that way the patient feels heard and it feels seen. Validation does not mean that you are agreeing with what their diagnosis is. That's not what it means. It just means that you demonstrate that you understand their experience and what they are verbalizing and saying to you. That's all that validation means. So that's that. Then the second question is asking them where they heard the diagnosis. So this is a key concept as well, asking where did they hear this diagnosis? Because chances are they heard it on TikTok or social media, or they might have had some friend who was experiencing this and it made them think that they might have it. But then if you can ask them this, and especially if the patient knows, then that cues you in the back of your head that, oh, okay, I need to be considering the where it came from, and it helps you to understand to where the patient might be coming from, because then it leads to question number 3 is what the diagnosis means to them. And what do I mean by this? Frequently I'll have patients come in with adult patients who think they may have autism, or they had a diagnosis of autism that was missed as a kid. And so now they're considering going for a diagnosis. And so a question I often ask is, what does it mean to them? Because now for the adult, getting an autism diagnosis isn't going to change their life. There's no treatment, like pharmacological treatment for autism. There's no extra school support that they're going to get, or work support, like nothing like that. So what does it mean for them to have the diagnosis? A lot of patients will say that it feels like it explains their past. It helps them feel like they have an identity. It helps them feel like there's a reason for all their symptoms. So that can be a positive for the patient. But then I've had other patients say, "You know what? Like, after thinking about it, I don't really want the evaluation because it's not really going to change things about my life. And I don't need to have this kind of label that's put on me, even if I put on myself." And so either or makes sense, but trying to figure out what the diagnosis means to them is very, very key. And then number 4, you go through the DSM criteria. Like you actually try to work on diagnosing it with the patient. The obvious answer, the obvious kind of reaction is to eye roll, right? Patient comes in, oh, I have ADHD. And so the thing is, a lot of these patients, they will self-identify with these diagnoses. Like when you look in people's TikTok bios, they will self-identify. They'll be like, oh yeah, DPD or ADHD. And like they've never had that diagnosis. They'll often say self-diagnosed. This is where you can actually put your degree and your clinical skills to the test, and you go through, you try to diagnose, you figure out if they meet the diagnostic criteria or not. So you do that, and you give them that grace where you work through it with them and not just kind of eye roll and assume that it's loaded BS. Because yes, there's chances are it might be totally BS and like it's explained by other things, but there's probably a reason that the patient is identifying with X or Y diagnosis, and they might have some symptoms of that diagnosis. For example, they think they have DPDR, but then there's a whole lot of trauma history that's going on that has been unaccounted for. Or, they say they have ADHD, whatever, but that could be like a social anxiety disorder. So you see, that's where you do want to work through the DSM criteria, not just roll your eyes at the patient. And then, so next step, right? So you work through it. So now you want to treat. So treat whatever you find. So whether it's one of these things, whether it's something else, whatever the diagnosis is, whatever the problem is, you want to treat it accordingly. And if you find out, especially if there is no diagnosis, so treat if you do find the diagnosis, or explain working diagnoses concept. So you can tell the patient that, hey, I don't think at this point you meet criteria for Tourette's or DPDR, but it doesn't really mean that, there isn't a problem still. And, this can be something that we consider in the future. This could be something that kind of comes up later on, or as we have more information. Some of these things take time to diagnose. We can't just diagnose on a first visit. So you can be a little bit more like non-committal with diagnoses. Diagnoses don't have to be established right then and there. So you can explain the concept of a working diagnosis, but whatever the problem is, then you can make sure that you treat that. And then lastly is maintain rapport, because the patient may or may not be satisfied with this explanation. So if the patients oftentimes come in and they want the diagnosis, like they want the diagnosis of Tourette's or ADHD, for example. And so when you explain that to me, it might break some rapport. So you want to make sure that you validate, use these steps. You still make sure you maintain the rapport with the patient, and just make sure that the patient is still bought in, that, and they still feel like you want to help them. If the patient decides to leave or go somewhere else, or they're just satisfied, that's on them. You did what you could, and you followed clinical guidelines as best as you could. But yeah, you want to just make sure that you focus on maintaining that patient rapport, because you can still help them work through the disappointment of not having these diagnoses. But yeah, this is the video explaining how to handle TikTok diagnoses when they come to your office. So if you want to learn more real life stuff, psychiatric skills, and these real world situations, and how to diagnose patients, how to treat patients, especially as a PMHNP, best place to do that is in our coaching program. So I'd recommend checking that out. And otherwise, I will see you in the next video.